Okay. So the first task is to your learning objective is to understand the structure of health and social care provision. So this unit, what will this unit aim at? It's to develop an understanding of the health and social care sector, and it aims and purposes the organizations that provide health and social care, along with an awareness of current issues impacting the sector in a chosen country. What are different sectors in health and social care? So there's primary, secondary, and tertiary. The NHS is divided into primary care, secondary care, and tertiary care. So primary care is the first point of contact or first point of care when people they're in need of health care. So it's usually provided by professionals like general practitioners, dentists, and pharmacists, whatever whatever service you require. So if it's a dental issue, you would obviously go to a dentist. Is there's something that the GP it is beyond the GP's scope, or the GP can't prescribe something, they would refer you to the secondary or tertiary care. Otherwise, if there's something that the GP could refer to the pharmacist also. So in that case, it becomes easier for the GP's job to refer you to the pharmacist, and the pharmacist would then prescribe you medication. Their role is there, it lies there. The NHS in England provides care which is free at point of use for almost 56.4 million people. Secondary care is sometimes referred to as hospital and community care. So they can be either planned, such as cataract or surgery. So a cataract surgery might not be an emergency one. So the GP's already planned it with you, or your secondary care provider has planned it with you. Or there could be urgent or emergency cases such as treatment of a fracture, which cannot be planned. Obviously, you don't plan to have an injury. That happens all of a sudden. But a cataract surgery can go wrong. There could be a internal bleed sometimes as a complication. And that would then become an emergency or an urgent situation. So secondary care deals with that. And tertiary refers to highly specialized treatment like neurosurgery, transplants, secure forensic mental health services. So these services, more or less, which exist in England, they exist throughout the world also. So it gives the care providers, it becomes easier for the care providers to give them a clear demarcation of what they need to do and how do they need to proceed with the cases that are out of their reach or out of their domain. And it gives the public also, or the patients, or the caregiver, or the clients also, an idea of where to go. So here we explain the aims of health and social care provision. So healthcare provision, it's described for various healthcare areas such as inpatient and outpatient care, rehabilitation, nursing services, prescribed medication, remedies, medical aids, costs for different healthcare areas, transportation, and costs in total. This is healthcare provision and the various domains within it. So it's basically it provides healthcare in different domains. So sometimes you might need nursing services, or sometimes you may have to use rehabilitation services. It depends upon what type of service you require. And then there's the social care provision, which provides support to people with learning disabilities, physical disabilities or illnesses, and mental illnesses. So this support will provide practical activities, personal care and social care intended to help the people receiving social care to live comfortably. Again, with the aims of health and social care provision, what is promoting health and well-being in health and social care? I want to know what is well-being. What do we mean by well-being? If any one of us can answer it, any one of you could answer that. What do I mean by health? Health, we know what is health. What is well-being in health and social care? Anyone? Anyone? What do I mean by health, by well-being? Okay.
Um,
Yeah.
hi.
Hi.
And to my understanding, it means the state of being happy or being comfortable.
Okay. Thank you. Being happy or being comfortable. Yes, that could be one explanation. Anyone else? Okay, that's fine. Thank you. So promoting well-being. So this involves actively seeking improvements in aspects of well-being. So well-being is, yes, living a comfortable life. This is when carrying out a care and support function in relation to an individual at any stage of the process. So from the provision of information and advice to reviewing a care and support plan, it could be anything. So well-being could involve very minute things to very essential and very complex things also. So what's the definition of well-being? So it is a broad concept. It is described as relating to the following areas in particular. So there's personal dignity, including treatment of the individual with respect. There's physical and mental health and emotional well-being also here. And there's protection from abuse and neglect, which again relates to well-being. Control by the individual over day-to-day life, which includes care and support provided and the way it is provided. It includes participation in work, education, training, or recreation. It includes social and economic well-being. It includes domestic, family, and personal relationships. It includes suitability of living accommodation, and it includes the individual's contribution to society. So it's a lot, and ultimately it leads to living a happy and comfortable life. So health it's very different compared to just health. So obviously all of this has an impact on health, and all of this has an impact of well-being also. So keeping people healthy. So this involves uh, people in your care, and treatment means supporting people to manage their own health and well-being on a day-to-day basis. It will mean supporting them to become involved as much as they want to or are capable of in decisions about their care, and giving them choice and control over the NHS services that they require or they receive. Now, there are different ways of involving people in their own health and care. So we've talked about keeping care that is patient-centered. That is very important, or client-centered, whatever makes sense in your case. So involving people in their own health and care, it requires services to shift the focus from of support from what is the matter with you. So you don't, that should not be your focus. Your focus should be what matters to you. So they should be taken into consideration. Their say should be taken into consideration. This acknowledges the individual as an expert in their own care, and it also gives people a greater choice and control over the care and support that they receive. So placing people's health in their own hands, they're responsible to a great extent for their own health. Um, So personalized care and support planning. So it's a systematic way with one or more long-term conditions that people are suffering from, and are supported through proactive conversations with their clinician or health and care professionals. So this is personalized care. So there's some care that is generalized, and some is it's a personalized care. So it's personalized only for one person, and it supports in planning for their treatment. It could be for their appointments. It could be for anything, for their surgery, whatever suits them, whatever treatment modality suits them, whatever their adverse reactions that they could have, that is according to, and whatever treatment timings could suit them. So it's a lot in personalized care. Then there's shared decision making. So it is a process by which people who experience a change in their health work with clinicians to select tests, treatments, management, or support packages. Again, this is shared decision making, which gives them the authority to work on their health in their own terms. What is best for them? We will have to see that also. So we would obviously not, there would be no compromises on that. So it's their health in their hands, but for their best interest. Self-management is the term given to a range of approaches that aim to enable people living with long-term conditions to manage their own health effectively. And then the last here on this slide is making health and care, social care accessible. So everyone has to have access to high quality health and care information. This would enable them to better understand their conditions. So since August 2016, there have been organizations that provide the NHS care or adult social care and are legally required to follow the accessible information standard. You can have a look at the standards over here. So, and then supporting those in need of medical or social care. How does this work? So the social care system is in place to provide help to those in need. So these are those people with mental health problems, learning or physical disabilities, vulnerable adults and children. A broad range of services provide a safety net to those who are most vulnerable. And this has been built into our society for several years now. Supporting those in need can be implemented in different ways. So you could provide care and support need assessment. So you assess what care and support do they require. A health and social care assessment would be carried out by social services in order to find out what help and support they need, like healthcare, equipment, help in their home or residential care. So this is again specialized care. So these are people who might need specialized care. So they're vulnerable people. They might be children, they may be pregnant women, they may be they might be people with mental health issues who can't do for themselves. And then developing health and social care plan. So this is an individualized care plan, and it will lay out how the patients could be supported and their care needs, how would they be met. So individual care plans or individualized care plans, they would cover a number of areas, which includes number one, the care needs identified in your assessment. So you have an assessment that you do, and then you assess that these needs are identified as care needs for this individual. How the local authority intends to meet the care needs. So there are different local authorities such as the Bolton, sorry, I'm here, so I know this council. So there's different councils setups that have that you would want to know about them, and you would want to know, is there a question anyone asked? Okay, so how, so your council or your local authority, how do they support you in your care needs, or how do they support patients in their care needs? The personal budget of that person should be viewed. An assessment of the ways the needs of these people can be reduced over time and how to prevent future needs from occurring. So these are individual care plans, and these plans need to be discussed with the person who's under that care. Individualized care plan will aim to support in a number of ways. So it encourages and supports the individual who needs this individualized care to live independently. So because you're making this plan according to their feasibility, their wishes, it then gives them a sort of independence that if you're not there forever for them, they still would be able to manage it independently. To
Excuse me.
have, yeah.
Excuse me. Sorry to take you back. You said individual care plans. How does the council help? They have to review the budget of the person. Yeah.
Yeah.
For
Yeah.
instance, if the budget the person has got is for one carer and he needs about 2 or 3 carers, would the council come in to assist them
Yes,
because his budget cannot cover it?
yes, that could be a possibility. So there are the number of ways that those plans could be assessed, and then they could be covered by local authorities. So it might not only be the council, it might be other organizations, it might be the NHS itself or outreach services, community care services. There are a number of services that would then come into play, and then whatever domain lies under whichever service, that would be accessed then for those individuals who cannot afford it. Hope this makes
I get it
clear.
now.
Yeah. And then to participate, okay, to have much control over your own personal life as possible, and to participate in the society as an equal. So you have individualized plans and you're participating, you're working, your work is not being affected, or whatever you are doing in the society, whatever your role you have in the society, that's considered as an equal compared to all the others who do not have these care plans or do not require specialized care. To have access to employment and family life, to ensure that you have the best possible quality of life, and to ensure your dignity and respect. So this is again, these individualized care plans will actually support you in all these domains. Talking about the current healthcare system in the UK, so I'm conscious of the time, sorry, and if need be, we might have to split this session because it's the first introductory session and it requires a lot of discussion also. So I might end by 11 o'clock, which is the time for ending the session. And then we might take it on for like tomorrow, same time, 10 o'clock. So the UK has a government-sponsored universal healthcare system. So that is called the NHS. We know about that. It consists of a series of publicly funded healthcare systems in the UK, and there are different organizations, different sectors working within the NHS. So we have the NHS England, we have the NHS Scotland, NHS Wales, and Health and Social Care in Northern Ireland. So citizens are entitled to healthcare under the system, but have the option to buy private health insurance as well. So sometimes the system is so overburdened, especially like in emergency situations like COVID-19. So people had to rely on private health insurance because they were not getting the care on a timely basis. So if you want to describe the organization of health and social care provision within your chosen country, if it's the UK, if you're talking about, so the NHS promises more power and information for patients, more hospital beds and hospitals, more doctors and nurses, significantly shorter waiting times for appointments, improved healthcare for older patients, tougher standards for NHS organizations. So this is actually a scheme that I would show you. So the structure of NHS is that there's a Department of Health and DOH, and then you have the NHS England, you have the NHS Improvement, and these all are interconnected. You see, it's like a web. So it's like there's not one way flow. So it could be a two-way flow, and then the different interconnectedness. So the Department of Health then the NHS England and NHS Improvement work under the Department of Health, and who do they oversee? They see the NHS England, for instance, it oversees the Sustainability and Transformation Partnership, which then has an impact on the local authority or has connectedness with the local authority. Now, the NHS improvement, for instance, would work with the NHS Trust for Hospital, Mental Health, Community, and Ambulance Care. And these are all they're given numbers, so they're different bindings or different rules and regulations. So that is why they're given numbers. And then this health and well-being, for instance, if you see, this is connected with clinical commissioning, a clinical commissioning group which works under the NHS England. And then here you see there are two-way connectednesses. So health and well-being boards are connected with local authorities, and local authorities then they respond to health and well-being boards. In the same way, the same exists for the Health and Wellbeing Board and its connectedness with clinical commissioning groups. And what is the ultimate aim? So all of this would improve GP and other primary care contractors, NHS Trust for Hospital, Mental, Community, and Ambulance Care, private provider of healthcare, and social care providers. So these are all improvements in just aimed at improvements in the system. And the arrows actually show national and local levels. And there are different arrows that show. So there's service delivery that shows, these red arrows show service delivery. Support is shown by green arrows. So there are certain organizations that provide support, and there are certain organizations that support in terms of finances. This presentation, this PowerPoint presentation will be shared with you on Monday. So have a good read of this and have a good look at this this scheme that I've shared with you. And we can have a good discussion on this on the next weekend when we have our class, not tomorrow, obviously. But if you could just take a picture also of this, we can have a discussion maybe tomorrow on this. And then if we can have a more in-depth discussion the next weekend. So this is very important to show you how the system works and what is the responsibility of each organization within the health and social care sector. So, and it's quite complex also. So, but it's a good way to give you an understanding. Then you describe the organization of health and social care provision within your chosen country. So if we take UK, for instance, it is one of the most efficient in the world. This is according to a study of 7 industrialized countries. So according to the Commonwealth Fund report, they looked at 5 areas of performance. So they saw quality, they saw efficiency, they saw access to care, equity, and healthy lives. So the Netherlands was the first overall, closely followed by the UK and Australia. So UK performed well when it came to quality of care and access to care. The UK has also been ranked as first in efficiency, which was measured by examining total national spending on healthcare as a percentage of the GDP or gross domestic product, as well as the amount spent on healthcare administration and insurance. So this was taken as the measurement was the GDP that was taken to show how efficient the resources were. So within your resources, how much are you spending for health and healthcare? So the UK was top on this. So there might be the countries who are not in the top of the list might have a low GDP expenditure. So their gross domestic product or whatever they are producing within the country, that is not as much as the healthcare system needs. So their products are the amount of funding that is raised within the country cannot cope with the country's healthcare system. And the healthcare requirements are even more compared to what the country is producing locally. So that is why people go for private health insurance or private practices instead of just the government ones. So, and then describing the organization of healthcare again, and social care provision. So healthcare systems in different regions of of England work in different ways. So healthcare in the UK is a devolved matter. So a devolved matter means it's there's England, Northern Ireland, Scotland, and Wales, which have their own systems of private and publicly funded healthcare. So, and there's alternative, holistic, and complementary treatments also. So there's not one system that's working. So these systems work separately and independently. The fact that each country has its own varied policies and priorities has resulted in a number of differences between the systems. So each country provides public health care to all UK permanent residents, and each also has a private healthcare sector, which is significantly smaller than the public sector. So most healthcare in England is provided by the NHS, which is public. And then social care services are a shared responsibility within the local NHS and local government's directors of social care services, and falls under the guidance of the Department of Health. Similarly, most healthcare in Scotland and Wales are provided by NHS Scotland and NHS Wales, respectively. The majority of healthcare in Northern Ireland will be provided by Health and Social Care in the Northern Ireland, which is still often referred to as the NHS for convenience sometimes. So government funded or private, let's see. We're talking again about the organization. So healthcare in the UK is publicly funded. We've seen that. This is mainly through our taxes, through taxations. However, the UK has also got a private health sector in which healthcare is acquired by means of private health insurance. This is funded as part of an employer-funded healthcare scheme or is paid directly by the customer themselves. Private healthcare has continued to exist, paid for largely by private insurance, and most health insurance products are distributed by the NHS. There's only a small sector that is distributed by private health insurance companies because of the excess amount. So obviously, if there's an NHS delivery that is free of cost, instead you're having to pay 100 or 200 pounds for an hour, that obviously will, this is specialized care. And that is why, because of the heavy amount that the person has to pay for it, it is not largely used. Sorry. Then we have rural versus urban care. So on an average, residents of more affluent rural areas live longer and lead healthier lives than many of their urban counterparts. So any idea why is this the case? I've made the statement that people who live in rural areas, they live longer and healthier compared to people who live in urban areas. Rural is village sort places, and rural urban is basically it's more the cities that I'm mentioning. Anyone?
So what's your question?
So the statement, I've not made a question. I've made a statement that residents of more affluent.
Okay, people living in the rural area live. Why are they living longer than the one in the urban area?
Yeah, why is this?
Yeah, because the rural area there's less pollution and less stress, and the environment is more green, and you get more unadulterated air and this thing, fresh fruits and everything to get in the rural area than in the urban area. Before they bring it from the rural, because most of the food we eat is grown in the rural area. Before they get it to the urban area, there's pollution and also many other things will go into it. So, and the kind of stress we have in the urban areas is not much in the rural area. The urban area is more congested, that before you move from one end to another, it takes more longer time. And you can imagine the amount of carbon monoxide you're going to inhale and others.
Yes, exactly. Anyone else? Thank you.
And I think they also get to exercise more. There's no sedentary lifestyle.
Yes, exactly. So there's more physical activity there. There's more fresh air, less transportation, pollution there. This is what the whole or the globe, across the globe, this is there. And there's less stress there also. So rural areas, they're living healthier lives because they're stress free also. There's no races. They're not racing to their workplace. They're not racing for. They have their own life setups. They might be running a farm. Probably they're more self-employed compared to employed under someone. So research done on, thank you everyone for your contributions. Yeah, research done on the UK healthcare usually tends to focus on urban environments where there's higher levels of deprivation, poor health, social need, and inequity. But when we talk about the rural communities, there's often they find them affluent and poor living in close proximity to one another. So this is in contrast to what is generally seen in research on average. So if you're living in a rural area, but you're living in a good rural area, it's not like you're living in a very deprived. Obviously, the deprived would not live longer. But if you're living in a good setup, in a good rural area, you would tend to live a healthier and happier life. If we see also our generations, if we see our ancestors, they lived happier, they lived longer because there was less stress. Stress has a very important impact. There were less, like people were more physically active, they were eating better, they were living better because of that. However, now when we see countries like, for instance, in the UK, or we see other countries also, there's countries that do not have good living conditions. Even if we talk about the rural communities, we talk about towns over here, small towns that have poor living conditions, don't have the basic necessities there. So in that case, okay, that's
Indian lè lọ gbà kó máa kọ́
yeah.
wa. Kò sí British ẹyọ kan tó sóyìnbó gidi. So òun náà máa sọ pé lecturer ló ní báyìí.
So urban health would be generally worse off than more of the rural areas, but there are exceptions to this rule also. So we talk about the urban setup. So the Department of Health is responsible for improving health and well-being of the people within England. The NHS primary care trusts have been established to improve health of their local population, to work jointly with a wide range of partner agencies to commission hospital and community care services, and to develop primary and community care services. Yeah. And then there's strategic health authorities. The goal of these authorities includes ensuring that the national priorities for health are integrated into local plans and strategies, and building the capacity of health services, and ensuring high quality performance is found within the NHS. This is for the urban setup. Now talking about the rural setup, you have the countryside agency there that states that their mission is to make life better for people in the countryside and improve quality of the countryside for everyone. Then you have the Institute of Rural Health, which is a UK-wide academic charity established in 1997. And this works to inform, develop, and promote health and well-being of rural people and their communities. And it has 3 academic programs. So there are research and projects that contribute to evidence base. And there's education and training, which develops a workforce fit for the purpose, and policy analysis, which includes rural proofing. So these three are basically academic programs that work, and they're largely based on research and education and training. And obviously, there's policy also there. Coming towards health legislation and self-regulation. So the Health and Social Care Act, we've talked about it several times before, 2012 was introduced, which and it was the first legal duties about healthcare inequalities. And it included specific duties for health bodies. So this included Department of Health, Public Health England, clinical commissioning groups, the NHS England, which requires the bodies to have due regard to reducing health inequalities between the people of England. This Health and Social Care Act 2012 also brought in changes for local authorities on public health functions. We have the Equality Act. We've talked about this earlier also. This was established in 2010. So it has duties for all public sector bodies, and it aims to integrate consideration for the advancement of equality into day-to-day businesses of all bodies subject to duty. So these are legislations 2012, 2010. Then you have the Social Value Act, which requires public sector commissioners, including local authorities and health sector bodies. They consider economic, social, and environmental well-being in procurement of services or contracts. Again, we have the Health and Safety at Work, 1974. Again, this is for employers and employees who are working, and they have to have safe working places designated for themselves, and the different duties and responsibilities that are there on every person who's working within that sector, within the health and social care sector. So they should be known to them already. Then you have control of substance hazardous to health regulations, 2002. This is for hazardous substances. So if there's any harm or ill health caused because of them, that has to be regulated. You have the reporting of injuries, diseases, and dangerous occurrences regulations, 2013. This is again, as the name specifies, the different forms that have to be filled in case of these. There are different reports that have to be there and have to be kept in as a record, basically, for future directions also. Then you have the regulatory reform, which has fire safety in it. So this sets out that every workplace must prevent or protect against fire. Now coming towards describing the size of the health and social care sector within your chosen country. I'll go just 2 slides beyond this, and then we might have to end this lecture today. And then we'll talk about this, we'll carry this forward tomorrow. So the sector, size of the sector in terms of finance, so healthcare expenditure in the United Kingdom, if we see, if we compare 2021, the 28th of June, healthcare spending in the UK has gradually increased since 1997, and it has amounted to 65 billion British pounds. So if you see, this graph has risen. And this increase of 13.1 billion British pounds on the previous year's healthcare expenditure. So that's a huge expenditure. Any idea why this has happened since 2021? Anyone, any idea?
I think because of the increase in the old population and the younger ones due to depression and mental health.
Yes, thank you. Anyone else?
And I think the increase in population as well, because if there's increase in population, there must be increase in spending as well, and modernization of so many things in the health sector.
Okay, thank you. Anyone else? Someone should say something about COVID-19, please. Do we have COVID-19?
Yeah, because of the expenditure we put, it was the expenditure on COVID-19, because so many people were at home and getting paid for doing nothing.
Yes, yes. And the sectors, they went down. The internet
Yeah, yeah,
had to rise. Yeah, you had to have
yeah,
more. Yeah,
have
so
to
if you,
rise.
yes, definitely, if you don't have an internet facilities,
And the
you at home.
the procurement of so many facilities that were unbudgeted for, like that were not formally being used. So many
Yes,
other this thing. So that's it
yes,
increased
yes.
during
So
the
let's say,
COVID-19.
yeah, definitely. So that's so if you're living in your house, working from home, let's say, you're spending more on the heating system. You're spending, if you don't have a laptop, you would have to get a laptop. If you don't have a desktop, you would have to you would require a desktop. You would have to have internet facilities that were not required. It was through the organization, which was free for you earlier. So all of these, obviously the healthcare, this is not related to the healthcare expenditure, but overall, COVID-19 saw a big blow on mental health also. And obviously, because there were so many patients admitted already, people with ailments were not seen on a regular basis like they were seen before COVID-19. So that also increased the healthcare expenditure. Please, can you mute yourselves, everyone? Thank you. And then if we talk about the size of the health and social care sector, if we talk about, we've talked about expenditure, now we talk about employment. So it's the number of people employed into the health and social care sector in 2020. Please, can you mute yourself?
Noise on the background is affecting, please.
Yeah, I'll just have a look at who it is. Okay, I hope that's better. Yeah. So in 2010, there were approximately 1,840,000 people who were employed by business and health and social work services sector in the UK, with 474,000 people employed in businesses that employed 500 or more people. This is because obviously people were there were more jobs being given to people. This was during COVID again. So there were people who were leaving jobs also, people who were dying because of COVID, who were being affected because of COVID. So organizations obviously they wanted to make up for those people. They had to have enough people for their organization to be run in a smooth way. So they had to employ more people. That could be one reason. There could be other reasons also. That is for you to analyze and to explore. And then the percentage of GDP. So healthcare spending in the UK as a share of GDP or gross domestic product has increased since 1997. It was 6.8% earlier. And now it has, in 2019, it amounted to 10.2%, which is a huge rise. So healthcare expenditure has in general experienced an increase in the overall time interval. So if we see this graph, I think this is the last slide that we will have, and I can take your questions if there are any. So this is the minimum price for home care in 2012, let's say. So you have, so this is the GDP where we're talking about. So there are different ways in which you see it. And you see the contact times, you see the running businesses. This slide is not very clear. I'll give a clearer one. I'll email it to you all. So it's care workers contact time, care workers travel time. All of this was increased. So this is minimum price for home care 2021 to 22. So all of this has risen. If you see, it has all these domains have been increased. All the GDP, the amounts that they were spending, their minimum hourly prices have increased. That is again because of the situation that's going on. And this then has given a rise in healthcare expenditure also. So what is GDP? It's the total value of goods that's produced and services provided in a country during one fiscal year. So I think, let me have a look at this. Yeah. So I think this will be the last one. Yeah, so this is the LO that we'll be completing. So provision of care compared to the population. So if we compare in 2017, the UK spent around £3,000 per person on healthcare, which was around the average of for members of the OECD. So it was a huge amount. So the members of the OECD, the amount that they had for themselves per person, the UK spent on per person on their healthcare, which is huge. And then UK healthcare spending per person was the second lowest, with highest spenders were France, Germany, and the United States. So if the UK is spending the lowest, the second lowest on healthcare, that should not be the case. It should be spending more on healthcare. So it would be the second lowest, which means that people were spending more on private insurances compared to taking funds from the NHS. UK healthcare spending fell from 9.8 in 2013 to 9.6 in 2017. So the healthcare expenditure further decreased. The UK's publicly funded NHS-based health system contributes to the UK having one of the highest shares of publicly funded healthcare, 79% in the OECD. And in 2017, the UK spent the equivalent of 560 per person on health-related long-term care, which was less than most other Northern or Western European countries, but a similar amount to France and Canada. I just want you to have a look at this slide, and we will have a thorough discussion on it tomorrow, and I'll ask questions based on this. Is everything clear?
Yes,
just
but I
have a-
have a question to ask.
Yeah.
Is regarding the assessment.
Mhm.
When do we start off the assessment, and when is it due?
Yeah, so once we are done with all the learning objectives, I think there are 4 learning objectives in this in this unit. So once they're over, I think it's the second weekend, not this, the second weekend. We will have then you will have a 2 weeks time to work on your assignments, and then after 2 weeks you'll be submitting it. So it gives you 2 weeks time to submit your assignment after the last learning objective is complete, which will be not this weekend, the next weekend on Sunday.
Okay, so if I get it correctly, you mean after we have this learning outcome, we finish this, you finish taking us